Some confinement centres here are offering new mothers mental health support, such as telehealth counselling and wellness activities. And that's especially after at least one hospital reported seeing a rise in postnatal depression cases. But beyond the confinement period and these services, doctors say what's still key is good family support and knowing when to ask for help.
Walking into motherhood is no easy feat, and as Paula Equator experienced firsthand, it also brought about its own challenges.
My first baby was only 1 year and 4 months when I gave birth to my second daughter. So she was still craving for so much attention.
Even though her husband helped out, Paula found it hard to cope.
Completely exhausted, not only physically but mentally and emotionally as well. I would, cry very often. Every day I would have, some type of crisis. I would have a breakdown.
Paula was formally diagnosed with postnatal depression after a visit to her gynecologist. And she's not alone. KK Women's and Children's Hospital saw a 47% increase in patients with postnatal depression between April 2021 and March 2022 compared with the same period 2 years before. It's also come up with a set of guidelines which emphasize the importance of screening so that mental health conditions can be quickly detected and treated. Confinement centres, which look after the well-being of mother and baby after delivery, are also introducing mental health services. And doctors from a telehealth platform train this centre staff to identify signs of depression in mothers.
We actually have a pathway where we continuously, across the entire stay, through various touch points to assess them, and also we have services for them post-exit of this confinement.
Another centre has introduced what it calls wellness workshops.
We give them candle wax making, essential oil making, tea appreciation, something that they can take their mind away from the daily routine that they're expecting for the baby care.
But even with such services, doctors stress that familial support is key.
The confinement period is really important because it gives her time to rest and recuperate from that experience. And it's even better if the family around her can show good support and also chip in to provide care for the baby.
Dr. Chua adds that the postnatal period is an important first step to motherhood. She warns that if mothers start their journey in a very tired state, they could end up even more stressed, and that could affect how they bond with the baby.